thing we're gonna do, so this is a microneedling pen, and you can actually see those little tiny needles. See those? So I get to pick the different depths that I'm using. So different areas of your skin are different depths, so I can use different depths, so I get to pick. Basically what it's gonna do is create microchannels in the skin, stimulate collagen, helps with pore size, helps with tightening of the skin, can help with a little bit of discoloration, does a lot of things, but really stimulates collagen, and especially if you have any acne scars and things like that, we'll work on those. Yeah, kind of breaks that up. All right, so you ready?
I suppose.
All right, you're all nice and clean, so we've already cleaned you out with a little alcohol. This is what it sounds like right there.
Okay.
All right, the first area we're gonna go a little bit underneath the eyes.
Okay.
This area typically pretty darn comfortable, okay?
Okay.
So you probably won't feel much. What do you think?
Nothing.
Yeah. Good. And what I'm looking for is I'm looking for some redness in that area, a little bit of swelling, and then pinpoint bleeding.
Okay.
So once I get there, then I can kind of move on. You're doing great.
I literally don't feel anything.
Yeah, it's like a little bit of vibration or
Yeah.
good. Perfect.
Yeah.
And that's kind of a trial. I'm actually gonna bump you up a little tiny bit on my settings. So we'll see how we do. And then of course, if you feel anything and it gets really uncomfortable, just let me know. I can always back down my settings, okay?
Okay.
So I don't have to spend a lot of time here because I know this isn't your area of main concern. What we're really gonna focus on, we're really gonna focus on this acne prone zone and right over there on the cheeks.
Okay.
So we might do some extra passes there.
Okay.
And you might be a little bit more tender, a little bit more red there for a longer period of time, okay?
All right. So will that acne come out by itself, or is that gonna like surface over
Well,
time?
some of this is really not active acne. It's not really coming to the surface. Some of it is, and it's already there. Some of these are they just discoloration from some previous acne breakups that you've had?
No, they just like will not come.
They
They're,
just
like,
won't come
bumps.
out. Okay,
Yeah.
gotcha. Yeah.
I have that.
Yeah. So what'll probably happen? Sometimes people can actually purge a little bit from this treatment,
Okay.
meaning that it could actually kind of trigger them to come out, which is
Okay.
really a good thing. You don't want them to lay in
No.
a little deeper level of your skin. You'd rather have them come out, heal, and then be done with it, right?
Right.
So this is looking great. You're nice and red. This is your first treatment, so we don't have to go too crazy
Okay.
because I know you'll be coming back for more. But
Yes.
this really gives us an idea of how you're tolerating the settings.
How long is there any downtime to this?
Yeah, there's not really any downtime to doing this treatment. She's gonna be red for a few days. She can wear makeup tomorrow though, so yeah. So you can put on a little bit of makeup if you want to. A lot of people, they like their skin to kind of heal and air out and breathe a little bit that second day. But sometimes it might be a little hard in some areas to cover up a lot of the redness unless you have a really good foundation. But yeah, not a lot of downtime. A lot of my patients will like to get this treatment done on like a Thursday or a Friday, and that way they have the weekend to recover.
Okay.
So that looks really good. We've got a little bit of pinpoint bleeding. You can see that right in there. And we're gonna do the same thing on the other side, okay? We're just gonna match that.
I still feel nothing, even though
Good.
it must be bleeding, I guess.
Yeah, and you don't even feel that. Yeah,
Nope.
good.
So what are you rubbing on my skin?
Yeah, so I'm using hyaluronic acid.
Okay.
So what this is, it's kind of like a liquid filler, because that's actually what our fillers contain is hyaluronic acid. And it holds 1,000 times its weight in water, so it's very hydrating. And the thought process behind this is kind of I'm using this one to kind of provide some lubrication between the microneedling pen and the skin so it's not sticking, so that would be very uncomfortable. But then what happens is that as I put a little bit of this product on, it kind of drives it in a little bit as well.
Cool.
Into some deeper layers, yeah. And if somebody has, melasma or some other conditions, we can actually use different products in that patient. You don't have melasma, so I'm not using any of those products for you, but that's something that we could do as well.
All right, cool.
How you doing? Still hanging in there?
Oh yeah, totally fine.
Good. You can't feel really any of this?
No,
That's awesome.
it is awesome.
Yeah, and you have that pinpoint bleeding, you're swelling a little bit. Looks great. This this is exactly the response I'm looking for. You know, your skin's nice and fresh too, you know, younger skin, so I don't have to work around some of the creases that I do in some of my older patients, but either way, it really helps those fine lines. Not that you have any right now, but
I'm getting there.
I don't know.
So how many treatments do you think I would need?
Yeah, so probably what I would recommend, I'd probably recommend about 5 treatments.
Oh wow, okay.
3 to 5 treatments. And now with this treatment, because it stimulates collagen, it doesn't work right away. So
Okay.
while you're gonna notice the redness right away, sometimes while you're healing, you'll notice kind of more, you know, brightness in your skin, more light reflectivity kind of in the properties of your cheeks and things like that.
Okay.
But long term is where you see a lot of the results, because again, it stimulates collagen. It doesn't do that overnight.
Right.